Namaste. I am Dr. Abhishek Shirkande, consultant nephrologist and kidney transplant physician at SL Raheja Fortis Hospital, Mahi, मुंबई। आज किडनी के बहुत सारे बीमारियां रहते हैं, इससे बहुत सारे पेशेंट्स पीड़ित रहते हैं, पेशेंट डायलिसिस पे आ जाते हैं। हमें देखना है कि बहुत सारी जानकारी रहती है, पेशेंट्स को बराबर रहती नहीं है। देर आर मैनी मिसकंसेप्शंस अमंग द पेशेंट्स रिगार्डिंग किडनी डिसीजेस, डायलिसिस एंड किडनी ट्रांसप्लांट। आज उसमें से थोड़े से हम जो जानकारी है वो सही जानकारी आपको देने की कोशिश करेंगे। तो we'll discuss today regarding the myths and the facts of kidney disease, dialysis and kidney transplant. So first of all, पता लगता है कि हमें हर कोई पेशेंट बोलता है कि एक बार किडनी की बीमारी हो गई दैट इज इनक्यूरेबल। नो, दैट इज रॉन्ग, इट इज अ मिथ। The fact is, kidney diseases are of two types: acute kidney injury and chronic kidney disease. Acute kidney injury means the patient will have a temporary kidney impairment, which can be due to many various problems such as infection, stone issues, urinary tract infections, dehydration, or due to ingestion of toxins. तो ये जब ये चीज़ें होती हैं तो हमें कारण अगर पता लग जाए कि किडनी क्यों टेम्परेरी अफेक्ट हो गई है, तो हम उस पे ऊपर इलाज करते हैं। जैसे इन्फेक्शन रहेगा, वी गिव एंटीबायोटिक्स, इफ इट टॉक्सिन्स वी गिव एंटीडोट्स, और वी हाइड्रेट द पेशेंट इफ द पेशेंट हैज डिहाइड्रेशन, एंड द पेशेंट ओवर अ पीरियड टाइम regain the function of the kidney. It is more successful in younger patients than in patients with diabetes and high blood pressure. तो जनरली हम देखते हैं कि जब पेशेंट्स को किडनी की बीमारी होती है, एक्यूट हो या क्रॉनिक हो, मतलब टेम्पररी हो या परमानेंट हो, परमानेंट के बात जब हम करते हैं तो दैट इज मेनली बिकॉज ऑफ इन इंडिया 33% ऑफ द किडनी डिसीज विच आर परमानेंट और लीड इन टू एंड स्टेज रीनल डिसीज। मतलब किडनी टोटली फेल हो गई, किडनी डायलिसिस पे पेशेंट डायलिसिस पे जाता है, तो द परसेंटेज अराउंड 32 to 35% इन इंडिया। Second comes high blood pressure, then autoimmune disease like lupus, then stone disease. तो इसमें क्या होता है कि पेशेंट्स ओवर अ पीरियड टाइम किडनी का फंक्शन स्लोली स्लोली कम होते जाता है। अगर हम पेशेंट को इस टाइम पे मॉनिटरिंग करेंगे प्रॉपरली, तो ये प्रोग्रेशन जो किडनी डिसीज का रहता है वो स्लो हो जाता है। जैसे अगर पेशेंट डायबिटिक रहेगा तो इफ यू टेक केयर ऑफ द पेशेंट्स शुगर कंट्रोल, ब्लड प्रेशर कंट्रोल, and we advise the patient regarding taking proper diet, lifestyle modifications, then all these things can be prevented. So it is very important for the patients of diabetes and high blood pressure to routinely monitor his kidney reports and the urine reports, and to refer to a nephrologist when needed. अगर उस दौरान पेशेंट को नहीं हम ऑब्जर्व करते हैं तो पेशेंट मे लीड टू इंस्टेंट रीनल फेलियर एंड ही मे रिक्वायर डायलिसिस। सेकेंड प्रॉब्लम रहता है जो हम देखते हैं कि अगर पेशेंट को किडनी का प्रॉब्लम होता है तो हम बोलते हैं कि पेशेंट को सूजन आ जाती है। ऐसे नहीं है, हर एक पेशेंट को सूजन नहीं आती है। अगर पेशेंट्स किडनी रूटीनली स्लोली स्लोली कम होता है, फंक्शन कम होता है, तो तभी पेशेंट्स का स्वेलिंग नहीं आता है। तो वी हैव टू मॉनिटर द ब्लड टेस्ट, द यूरिन टेस्ट. So swelling is not the only part. We call that pedal edema is not the only part which defines the kidney disease. Then again there are other problems such as पेशेंट बोलता है कि मेरी एक किडनी कमजोर हो गई है, या किडनी छोटी हो गई है, या एक किडनी स्टोन की वजह से खराब हो गई है, तो मुझे डायलिसिस लगेगा क्या? No, that is not the general the case. If the other kidney is functioning properly and you are taking care of that kidney, then you can have a good life. That is the only dictum which we follow in transplant. We do live donor transplants where we take one of the kidneys of the patient and the patient does well, the donor does well after transplant. So एक किडनी पे भी आदमी अच्छा जिंदगी जी सकता है. He can carry on with daily activities provided he keeps a watch on his blood reports annually or every 6 months. इन पेशेंट को हम बोलते हैं आपका बीपी पे ध्यान दीजिए, आप पेन किलर्स का सेवन ज़्यादा मत कीजिए। तो ये सब चीज़ें फॉलो करना बहुत ज़रूरी है। सेकेंड थिंग इज़ दैट हम हर एक पेशेंट को ऐसे बोला जाता है कि पानी बहुत पीजिए तो आपको किडनी की बीमारी नहीं होती है। ये इन अ सेंस इट इज़ ट्रू दैट पानी ज़्यादा पीने पे मेनली स्टोन डिसीजेस नहीं होते हैं, बट पेशेंट को हम अदर फैक्टर्स भी रहते हैं, जैसे पेशेंट को अगर हार्ट का प्रॉब्लम रहेगा, पेशेंट का हार्ट का पंपिंग कम रहेगा, तो इनको हम ज़्यादा पानी नहीं पिला सकते, दे मे लैंड इनटू हार्ट फेलियर. So it is very essential to optimize the treatment or the water intake for each and every patient according to his medical condition. So it is not a general dictum कि हर एक पेशेंट आएगा तो हम उनको पानी पिलाने बोलेंगे. Yes, if the patient has stone problem, patient is young, then one of the treatments for stone disease is medical expulsive therapy, which we give advise the patient to have a lot of liquids. But it's not the only thing which we should see. देन पेशेंट को एक बार पता लग जाता है कि किडनी का अगर हमने गोली दी, अगर आप समझे पेशेंट हमारे पास आए या ट्रीटमेंट ले, तो अगर उनको किडनी की कुछ गोलियां चालू की, ही फील्स बेटर, देन ही स्टॉप द ट्रीटमेंट. दैट इज कंप्लीटली रॉन्ग. ही फील दैट इज ओके, व्हाई शुड टेक द ट्रीटमेंट? नो, दैट शुड नॉट बी डन. द पेशेंट ऑफ किडनी डिसीज, if it is diabetic and diabetic kidney disease or hypertensive kidney disease, he should follow up with his nephrologist or the physician on regular intervals. He should not stop the treatment. On the contrary, the treatment over a period of time as the kidney disease progresses, if he is not following proper diet or he takes some painkillers or if his sugars are not controlled, the medicines, the dose modification is there. मतलब हर एक गोली जो हम जनरली आप देखे जाएंगे कि जनरल नॉर्मल फैमिली प्रैक्टिशनर्स या जनरल फिजिशियंस, they are very afraid to give patients medicines who are suffering from kidney disease, because most of the antibiotics, painkillers, antipyretics, these have a kidney excretion. So the dose modification is very important. So it is very important to follow up with your nephrologist or the physician regarding the what medicines to take and what doses of the medicines to be followed. देन अदर थिंग इज दैट हम देखते हैं कि आप बहुत सारी चीज़ें देखेंगे कि किडनी क्रिएटिनिन, सीरम क्रिएटिन हम बहुत देखते हैं कि सीरम क्रिएटिन आपने चेक किया कि नहीं. सी क्रिएटिनिन इज ओनली अ मार्कर ऑफ किडनी डिसीज. It doesn't define how the kidney disease progresses. So we had it is just one marker, but we have other markers such as urine test. Like urine हम protein check करते हैं, patient का blood pressure, we see the potassium levels, bicarbonate levels. So not the only creatinine levels is seen. Even though creatinine is supposedly 1.2 now, but 3 months prior the creatinine was around 0.6. The jump, even to 1.2 in most of the labs, is considered to be normal. Still, the jump is from zero point 0.6 milligram per deciliter to 1.2. So it is quite a significant jump. So lab will say that the reports are normal, but no, we have to see if there is any problem regarding increase in the creatinine level. So normal creatinine can also fluctuate. So it is very important to follow the blood reports routinely and keep a proper check of the rising creatinine. It gives us a fair idea, but not the complete idea of the kidney disease. Then most of the patients who come to our hospital or for consultation, they feel that kidney disease तो मुझे इतना है आप बता रहे हो डॉक्टर साहब, लेकिन मुझे कुछ लग नहीं रहा है. See, that is very common in patients who are in chronic kidney disease. उनको बहुत सालों से किडनी का बीमारी होता है, उनको ऐसे पता लगता नहीं. They are used to this high creatinine because it slowly increase होता है. तो when the patient comes, they will have some mild symptoms कि हमें भूख नहीं लगती है ज़्यादा, हमें खाना नहीं जाता है, हमें नींद पूरी नहीं होती है, हमें थोड़ा सा वीकनेस लगता है. They will not say that they are breathless और यूरिन कम हो गई, हमें swelling आ गई. But the reports can be very high creatinine or high potassium. Some of the patient may require dialysis. So it is very important to clinically examine the patient also, and not only see that the patient general condition how it is. So दूसरी चीज सबसे बड़ी है, we have a very big burden of dialysis patients. डायलिसिस पेशेंट्स की मात्रा मुंबई या पूरे देश में या पूरे विश्व में बहुत सारे हैं. Patients are lot of on dialysis. There are left right dialysis centers cropping up. We have charity dialysis centers. Patients are on dialysis twice a week, thrice a week. तो डायलिसिस में पेशेंट्स आर कंप्लेनिंग दैट अभी ये सर आपने डायलिसिस चालू तो किया है, बट विल इट बी एट परमानेंट नीड और आई विल डू इट टेम्पररी. सी अगेन इट डिपेंड्स अपॉन व्हाट द पेशेंट इज सफरिंग फ्रॉम. द पेशेंट इज acute kidney injuries, as I told you before, then the dialysis may be temporary. That time the patient is observed very periodically, and then the dialysis schedule is adjusted. But the patients over a period of time with the same nephrologist and he feels that the kidney disease is progressive, so over a period of time the dialysis will be permanent. So they need to do a AV fistula जिसमें हम डायलिसिस कर सकते हैं या उनको परमानेंट कैथेटर डालते हैं जो गले में डाला जाता है. ये फ्रीक्वेंसी डायलिसिस कितना लगता है, ट्वाइस अ वीक, थ्राइस अ वीक, इट इज इंडिविजुअल पेशेंट. अगर पेशाब कम होता रहेगा, पेशेंट को हार्ट का प्रॉब्लम रहेगा, तो डायलिसिस का ड्यूरेशन ज़्यादा लगता है. सो द ओनली थिंग द पेशेंट हु हैज क्रॉनिक किडनी डिसीज और इन आर वे वी से दैट ESRD, एंड स्टेज renal disease, the patient require dialysis. The only way to get out of the dialysis is do a renal transplant or a kidney transplant. One more thing is that the patient, some of the patient who are not so educated, they say that sir, dialysis we are doing from 3 months. My kidneys are not getting cured. So dialysis is not the cure. Dialysis is a support. What is dialysis? Dialysis and the dialysis filter, it acts as the kidney. It acts as the kidney filter. Kidney is nothing but a filter which absorbs the toxins and the excess water and removes for the body. But if the patient is on dialysis, the dialysis does the same work as the kidney. जो काम किडनी नहीं कर पाती है, जैसे ब्लड प्यूरिफाई करना, एक्सेस टॉक्सिन जो ब्लड में जमा होती है किडनी फेल होने की वजह से, जो निकल नहीं पाते हैं वो डायलिसिस निकालती है. जो पानी पेशाब से नहीं निकलता है वो डायलिसिस निकालता है. So it is a very big myth that dialysis is the cure of kidney disease. No, it is a support. If you don't do dialysis, then the toxins will build up in the body. Again, you have the same symptoms which will cause you hospitalization. Again, there is other myths such as the patient says that sir, हमारा dialysis center is quite far away. So can we? Is there any other option? Yes, if there is a dialysis center which is far away and the patient cannot do, there are two types of dialysis. One is the hemodialysis जिसे हम खून का डायलिसिस बोलते हैं, और दूसरा पेरिटोनल डायलिसिस जिसे हम पेट का डायलिसिस बोलते हैं. जो खून का डायलिसिस रहता है, इट इज अ सेंटर बेस्ड डायलिसिस सेंटर. एक सेंटर में जाना पड़ता है, उधर टेक्नीशियंस नर्सेज रहते हैं जो आपका प्रोसीजर डायलिसिस प्रोसीजर करते हैं, ब्लड प्यूरिफाई होता है और आप 4 घंटे के बाद घर जाते हैं. दिस कैन बी 2 to 3 times in a week डिपेंड अपॉन द पेशेंट. बट देयर इज अदर ऑप्शन कॉल्ड एज पेरिटोनल डायलिसिस, पेट का डायलिसिस, जिसमें हम पेट में पानी डालते हैं. पेट का जो पानी जो जाता है वो पेट में रहता है, इट ऑब्जॉर्ब्स ऑल द टॉक्सिन्स एंड आफ्टर 1 hour वी अगेन रिमूव द वाटर. सो इट कैन बी डन एट होम, but it is a very sophisticated procedure. The patient needs to understand what is the dialysis procedure, peritoneal dialysis procedure. इसमें इन्फेक्शन चांसेस रहता है, पेशेंट को बराबर मॉनिटरिंग करना पड़ता है, बिकॉज यू आर डूइंग एवरीथिंग दिस एट होम. आप सब घर पे करते हैं. हीमोडायलिसिस क्या रहता है कि वो सेंटर में रहता है, उधर डॉक्टर्स रहते हैं, उधर सिस्टर्स रहते हैं, उधर टेक्नीशियंस रहते हैं, तो दे मॉनिटर ऑल योर वाइटल्स. वाइटल्स मीन्स दे मॉनिटर योर पल्स, द ब्लड प्रेशर, and they, if any problems are there, they will handle it. But if you are doing at home, it is very important to the patient and the relatives to get educated about the treatment. A new thing which is coming up, which we do at Raj Hospital, is something called as home dialysis, like hemodialysis, home hemodialysis. So we, in this case, we tell the patient that they can set up a dialysis center at home. मशीन आपको घर आप सेटअप हो सकता है, आरओ प्लांट हो सकता है, और घर पे ही आप डायलिसिस कर सकते हो आपके सुविधा अनुसार. So that is a new thing which is coming up, and many of the patients do that. Again, patients are saying that dialysis is painful. See, that is again a myth. Dialysis is not painful. If dialysis is done properly, patient can live a active life and healthy life. But dialysis has to be done properly according to prescription of the nephrologist with regular follow-up to the nephrologist. Again, one more thing which is quite concerning because of the increasing dialysis burden is the cost of dialysis. So some of the patients say that sir, आप बोल रहे हो जिंदगी भर डायलिसिस लगेगा हमें, बट इतना हम अफोर्ड नहीं कर पाते. डायलिसिस कॉस्ट इन अ गुड सेटअप may cost up to 1200 to 1800 rupees. Then every session at 1800 is quite costly. But because of the government setup and the burden of that, the government has many setups where they do affordable dialysis. There are many schemes such as CGHS schemes, then there are Mahatma Phule schemes, which the dialysis is free. Also, many charity hospitals are there where they do free dialysis and do at minimum rates. So there are many options. So don't think that the patient or your patient is non-affording to not do dialysis. Discuss with your nephrologist. He'll give you better options. He'll give better options near your home, so that you don't have to travel too much. And of course, he'll give you affordable substitutes also. Again, the other thing is dialysis patient can't travel. Can't travel. That is wrong. Patients on dialysis, if they plan their traveling schedule or their holidays properly, the dialysis can be done properly. See, when the patient is taking dialysis in our hospital or in our setup, when they went on to visit to other city or outside, the stay is small and the dialysis duration, the frequency is not that much. They can adjust the dialysis schedule accordingly. However, if the patient require very regular dialysis and he has a longer stay abroad, so we do something called as holiday dialysis. Holiday dialysis is nothing but the patient will given the prescription of his own nephrologist to the nephrologist to that hospital, and he'll tell him that this patient will have a dialysis schedule of such and such, and the prescription is will be advised. So that thing is followed, but the onus is on the patient to take the care that he doesn't miss the dialysis. It is very important that patient doesn't miss the dialysis, otherwise his symptoms may worsen up and may land for hospital admission. Then one more myth is that the patient of dialysis are very weak, very they are not able to walk or they are not able to eat properly. No, that is also a myth. The patient is doing proper good dialysis. There is no worry that the patient will have such a problems. He will eat properly, he will sleep properly, he will walk properly. No breathlessness. But the condition is that the patient should do the dialysis properly, take the medicines properly, follow up with the nephrologist properly, keep the blood pressure under control, keep the sugars under control. If the patient has nutritional deficiency, it is very important to take care of it. We can give nutrition supplement during dialysis, or the patient can have nutrition supplements at home. Then other thing is that about kidney transplant. So we'll speak about kidney transplant mainly. So as I told you previously, we can take a kidney from one of your relatives, and we check the patient's donor, like who is donating the kidney, very carefully. So for us as a nephrologist, the patient who is suffering from kidney failure as well as the donor who is giving the kidney, both are equally important. So we do all the tests which are required. We do genetic mapping. We do cross matching. We do cardiac evaluation, urological evaluation. We do kidney scans to see how the function of each kidney. And when all the things along with the legality is supported, then we go for a kidney transplant. It is very essential that the donor is evaluated completely, and then only the kidney transplant can be done when we are sure that the donor will not suffer after donating one of the kidneys to the patient. So again, the thing is about kidney transplant. When there is such a misconception or a myth that when you give one of the kidneys, I will not be able to lead a healthy life, or a female may feel that if the female is donating the kidney, I will not get pregnant. So again, that is a myth. It is very essential for me as a nephrologist and the counseling team to tell the patient and the relatives and to allay all their fears regarding kidney transplant. The patient after the donor after giving the kidney or donating the kidney is taken care of in the hospital. See, the transplant procedure for the donor he is in the hospital for 1 day, in the ICU for 1 day, then in the ward for 2 days, and by the fourth day he is discharged. So it is very important to follow up the patient first time for first few months regularly, and then every 3 monthly regarding these kidney reports and the urine reports and the blood pressure monitoring. But over a period of time, the patient will lead a healthy lifestyle. He has no problems, but he should be aware that he should be taking regular blood tests. Again, we have a very big problem in our society that there are many WhatsApp groups coming up with social media is there. So we are like, getting messages, or we are you must have also seen messages about ये फलाना किडनी इधर अवेलेबल है, हमें उसको कांटेक्ट कीजिए नंबर को, तो आपको हमें किडनी डोनेट करनी है. So this is all quacks. This is not legal. So don't fall for a trap. kidney donation is a very efficient procedure. It is a very strict procedure, and there are strict laws for it. So whenever a kidney donation is taking place, the government and the law has to take his course. So if there is a live transplant, obviously the hospital and the donor and the recipient is matched. But if such a cadaver means if there is such a body which is available, brain dead body which is available, which is capable of giving kidneys, so the hospital administration decides it, not the WhatsApp group or any person contact group which is saying that contact us. The hospital has its own medical team. They have their own administration team. They have their own cadaver declaration team which evaluates the patients if his kidneys or other than kidneys his heart, liver are available for kidney transplant or are available for transplant or not. Then only the procedure goes on. So please don't fall for the trap that's for the WhatsApp messages which is just viral around that so and so patient will have kidney transplant. Again, as I told you, the female patients can get pregnant after donating the kidney, as well as the patient who is receiving the kidney, if it's a female and she wants to go for a pregnancy, we have to first 1 year, we do not generally advise the patient because they are on very heavy immunosuppression drugs, which may cause problem in the pregnancy. But after 1 to 2 years, when the graft or the kidney transplant is stable, then she can, for the minimum immunosuppression, BP is controlled, then she may go opt for transplant, but in tertiary system where all the doctors, the nephrologist, the gynecologist is available. That can be done. That is successful. So it is very important to know all this information about kidney transplant, dialysis, kidney diseases. We at SL Raheja Hospital are readily available for you 24/7 for all your queries, for all your doubts regarding kidneys, kidney diseases. We have a extensive setup for ICU for dialysis. For we have a AKD, which is a department for dialysis. We do dialysis round the clock in 4 shifts. We do kidney transplantations on a routine basis. So if the patient is suffering from diabetes, high blood pressure या किडनी डिसीज हो पेशेंट को या पेशेंट को अगर डायलिसिस की ज़रूरत हो या you have any you want any clearance regarding any kid or any queries to be sorted out, we are always available here for your service. So please, if any queries are there, please reach out to us. Thank you.